So my name is Hillary Spangler, and I am a graduate of the class of 2013 here at NC State in Nutrition and Biological Sciences. I knew I wanted to do something medical coming into NC State, and originally thought I was going to do physical therapy because of a childhood illness that I had, and had a lot of physical therapy for that. And then about my junior year of college, thought I wanted to do something a little bit more broad and maybe not as specialized, that I could still incorporate my passion for physical movement, but just kind of the overall general health of individuals. And so that led me to medical school, and applied after college and ended up going to UNC for medical school, and then stayed to start a residency in internal medicine and pediatrics, a dual residency, in 2017. I'm a second-year resident at UNC in internal medicine and pediatrics, and so that means I do both adult medicine and pediatric medicine. And how a lot of these residencies, dual residencies, are set up, you do a split time, so we do 3 months of peds and 3 months of medicine, and it's really nice if you like to do lots of different things and have lots of different interests, because there's always something new to do, and you're never bored, that's for sure. As far as the preparation I received here at NC State, NC State really, it prepares you for life. I know that sounds really cliche, but it's true. The skill sets that you receive here and the people that you meet here, they're really helpful about how figuring out how to get you into a network somewhere and where your niche is. And depending on which side of the medicine world I'm on, so if I'm on the adult world or in the pediatrics world, and if I'm at the hospital, so we do some inpatient time, which is considered hospital time, and then outpatient, which would be like your clinic you would go to for your checkup, your yearly checkup. And so if I'm in the inpatient world, it usually starts a little bit earlier, and so I get to the hospital about 6:30 or 7, and that day is usually a 12-hour day or so. The clinic days usually start a little bit later, about 8 a.m., and we'll go to 5 or 6. And the clinic that I actually work at in residency is a dual clinic, so we see both adults and pediatric patients. And then in addition to the clinical time, and as a lot of you probably do here or looking to do here, I do some research in quality improvement, as well as some medical device things related to my interest in sepsis. Yeah, so I use nutrition in my current job a lot. That was one of my draws here at NC State, and choosing nutrition as a major was because I thought it was so applicable to everyday life and my life, and I did at that time know that maybe I wanted to apply that to medicine. But especially counseling patients on how to lead healthier lifestyles, and that, here at NC State helped me learn that everybody has a different definition of healthy, and meeting them, it's a roundtable discussion and seeing eye to eye kind of what that is for your patient or your client when you're a registered dietitian. But just in the educational standpoint of being able to educate patients in a way that they understand, it's been very helpful to have that skill set. After NC State, learned that I had some other interests as far as writing books and children's books that focus on healthy life or healthy living and helping others develop healthy lifestyles. Because that's really a culmination of all of my passions, and being able to share passions about reading and literacy, especially in the pediatric population, as well as encouraging families to read together and then learn how to live healthy lifestyles. Going back to the Where is Henry book is probably one of the things that I'm most proud of, just because it is, in a way, hopefully kind of a thank you to not only individuals here at NC State, but people who have helped me be successful on the path that I've chosen, and because it really does take a village, and no matter what you do, and it's important to me to give thanks, and I feel like that is a labor of love, and something that lots of people help me figure out how to do and how to have the knowledge to do. I think a big part of college and having and you know going forth in your career is learning to stop, to take time and smell the roses, as cliche as it sounds. But you'll always be busy, and that's a great thing. Being busy is a great thing, especially when you've found what you're passionate about and you're excited to do those things. But making sure that you take time to savor those moments, no matter how hard it is. But just being able to, I think I would have loved to take a step back and learn to appreciate those moments more, because you truly do grow during those. And I think it's something that is a skill that will benefit you going forward. Seize every opportunity, and ones that you're particularly passionate about. And the wonderful thing about NC State and the nutrition department here in particular is that there are so many passionate people and faculty here ready to help you do whatever you want to do. And that's really, really a gem of a thing to have and doesn't exist everywhere. And so just making sure that you figure out whatever it is that you love to do, and it's that being something in nutrition, reaching out to people to ask them to say, hey, you know, I have this idea, or hey, who can I talk to you to do this? Because certainly if they don't know the answer, they will put you in contact with someone who does, and so you can build your base and your framework of you know, these lifelong projects that you can start, and so just really seizing the wonderful opportunities that you have here, because it's really NC State and the nutrition department is really a place like no else.